Today, I am taking lecture on stress-related disorder. Stress, you see, is commonly discussed, and everyone knows that sometimes they feel they are in stress. Particularly the students, they have to appear sometime in examination. They feel stressed. Sometimes, so many new situations, if they come across, they become stressed. This is one term used very commonly uh, in day-to-day practice. In commonly students and everyone use that the term stress. But what is its scientific basis? What is his what is his relationship with the various psychiatric disorder? I think the student must understand about it. Then, how to define stress? Yes, what is stress? First, a set of emotional, physical, and cognitive reaction to a change. That is, and stress is an internal state which can be caused by physical demands of the body, exercise, extreme of the temperature or disease, or by environment and social situation which are evaluated as potential harmful, uncontrollable, and exceeding our resource of coping. Stress is the disruption of the homeostasis through physical and psychological stimuli. Everyone you see is it remains in homeostasis, and if it is affected, I think the stress is occurs because of disruption of the homeostasis. By most likely, it is internal factor or the external factor. What is the relationship between stress, anxiety, and tension? These commonly used terms are everyone experiences stress and anxiety at one time or another. The difference between them is the stress is a response to a threat in a situation, anxiety a reaction to the stress. That threat situation leads to stress and anxiety. Very important. First thing is there is some threat to the situation, and that leads to stress, stress leads to anxiety. Common in all these is that individual experience excessive uneasiness. Stress may lead to anxiety. Stress-related disorder results from the exposure to traumatic or stressful events. These disorders are no longer considered anxiety disorder because many affected people do not have anxiety. They have other symptoms instead. For example, they may have sometimes they are unable to experience pleasure, become aggressive or feel restless and discomfort, angry, numb, or disconnected from themselves. Almost all psychiatric disorders are related to the stress in some or other. What are types of the stress? Researchers divide stress into first is eustress or positive stress. Sometimes it is that there is positive uh, consequences. It is required. It motivates, focus energy. Is short term, is perceived as within our compelling coping abilities, feel excited, improve performance. I think every student, whenever examination comes, their dates of examination declared, they feel distress. They have sometimes palpitation, restlessness, or they are thinking about what will happen. And so this leads to one of the anxiety, feeling of anxiety, anxious. But this is one of the coping strategy that is essential. The students are preparing for the examination and they prepare their performance. Here again, if best performance is there, there will be no anxiety, no stress at all in the individual. If they have still doubt about their performance, they may have anxiety before examination. Why the exam before examination anxiety occurs? This is because of duality towards the examination. That they just don't feel they are have not prepared well, they may be incompetent and so may not succeed, may not go through that examination. So they have become and they develop stress, and stress leads to anxiety. This stress are negative stress. One is positive and second is negative stress. Persistent stress that is not resolved through coping or adaptation may lead to escape anxiety or withdrawal depression behavior. It decreases performance, can lead to mental and physical problems. Now, historical aspect of the uh, stress and related anxiety and other disorder. It's very important to know about how this term stress evolved and what is nowadays current position. Understanding about stress is term stress was coined sometime Hans Selye. He was born in 1907 and died in 1982. He is the person who has done a lot of work uh, in this field. He reported that there is general adaptation system that characterize response to perturbation. Adrenocortical system as the crucial responder to the stress. Walter Cannon, he was born in 1871, died in 1945. Methodologically investigated pathway of stressful response, the sympathetic nervous system, focus on the immediate and short-term response to stress. This is distress cycle. Uh, First, different type of stresses. It might be any type, and there are lot of type. It might be stress, might be sometime loss, financial problem, the separation from spouse, it may be, and likewise there are so many things that in Corona period, non-availability of the treatment was one of the best stress, and feeling of apprehension that what may happen if they are not getting treated. The stresses, if it overloads, then their immediate effect is on the behavior, physiology of the person, emotional and cognitive area of a person. Behavioral changes leads to overeating, alcohol consumption, physiological, muscle tension, raise in blood pressure, and heart rate. Emotional uh, consequences leads occurs in the form of anxiety, depression, anger, and cognitive distractibility. And long-term effect of the stress are behavioral disorder, medical disorder, emotional disorder, cognitive disorder. Behavioral disorder occurs in obesity, alcoholism, and medical headache and hypertension, emotional anxiety, depression, other mental illness. Cognitive disorder occurs in the form of insomnia, memory problem. Overall effect leads to decreased productivity of the person, decreased enjoyment, decrease intimacy or interpersonal relationship. Now, the word term used is general adaptation syndrome. The general adaptation syndrome or GAS was this was described 1955 by Hans Selye. And according to him, there are certain stages. For one stage, first is stage of alarm. Second is stage of resistance. Third stage is exhaustion. These are the stages of the that we have to understand. What happens in stage one? The body's stress response is a state of alarm. During this stage, adrenaline will be produced in order to bring about fight or flight response. Activation of HP axis leading to more production of the cortisol. In stage 2, there is resistance. In the stressor persists, the body begins to try to adapt to the strains or the demands of the environment. The body cannot keep this up, so its response are usually depleted. Now, what happens in stage 3? Uh, all the body response are depleted. The body is unable to maintain normal function. At the point of the initial autonomous nervous system hyperactivity, certain symptom appears in the form of sweating, raised heart rate. If the stage 3 is extended, long-term damage may result in the capacity of as the capacity of internal gland uh, uh, exhausts. The immune system impaired and resulting in the decompensation. The result can manifest itself in illness such as ulcers, peptic ulcer, any others, depression, cardiovascular problem might be one of the consequences. Now, what happens to the various neurotransmitter system by the anxiety and by the stress? Acute stress leads to increased 5-HT release transiently. Glucocorticoids increase action of the 5-HT. Increase dopamine in visual frontal pathways. Increase synthesis of norepinephrine. Chronic stress leads to decrement of the 5-HT in the brain, decrement of 5-HT stores in the brain, increase of 5-HT1A receptor with decrease in the 5-HT transmission. Then dopaminergic system. What happens to on this system? Dopamine is a catecholamine. Is released in response to diseases in a number of associated brain areas important in the regulation of affective behavior, including the basolateral nucleus of the amygdala, the nucleus accumbens, and the medial prefrontal cortex. The dopamine innervation of the medial prefrontal cortex appears to be particularly vulnerable to the stress. What happens to the serotonergic, the neurotransmitter system in stress? Serotonin or 5-HT, the release of which is regulated by the dorsal rapid nuclei, is secreted in response to stress. Serotonin has been shown to have a dual role in anxiety. Serotonin hypothesis anxiety states that 5-HT may be angiogenic through its action on the prefrontal cortex and amygdala, causing a heightened awareness of the threat. Then it may be anxiolytic by its action on the dorsal periaqueductal gray region, thereby inhibiting fight or flight behavior of a person. What happened to the endocrine in the stress? It in response to stress, CRH, corticotropin releasing hormone, increases in along with ACT, ACTH. ACTH release glucocorticoids and promote energy use, increase cardiovascular activity, inhibiting function, growth, and immunity. You see that so the cycle has shown. Psychoimmunology. Study of the bidirectional interaction between brain and immune system. CNS and immune system lead to major physiological system. What happened to HPA axis and autonomous nervous system? Sympathetic nervous system into gland and cause release of the norepinephrine. Some sympathetic activity reduces the activity of NK cell anti-lymphocyte, protection of antibody, B cell, and ability to macrophage to release cytokines are enhanced. Cortisol suppresses cellular immune system, while stress increases inmates and cellular immunity while sparing or enhancing the hormonal response to the pathogen. What are symptoms of stress? They are physical symptom, mental symptom, behavioral symptom, and emotional symptom. Physical symptom are like person have sleeplessness, person may feel fatigue, the person may have digestion problem, diarrhea, and loss of sexual drive, headache, aches and pains in the body, infection, indigestion, dizziness, feeling of fainting, sweating and trembling, tingling hands or feet, breathlessness, perspiration, and missed heartbeats. Mental symptoms are lack of concentration, poor memory, difficulty of managing making decision, confusion, deorientation, pain, thereby finding a day. Emotional symptoms are bouts of depression, the importance of the emotion in a person become because of it impatient and fits of rage. Sometimes automatically they become irritable and they feel discomfort and they have anxiety. Then a deterioration of the personal hygiene occurs in appearance also with continuous anxiety and depression. Other stress-related illnesses are cardiovascular disease. Myocardial function is one of the important risk factor. Now it is said no, that there may occur ulcers, skin complaints, psoriasis, headache and migraine, premenstrual syndrome, depressions. Evolution of the and concept. Severe stress has always been associated with the health-related impacts, but it was not until after the First and Second World War that increased attention was paid to psychiatric consequences of the stress. The term acute stress reaction was used to describe the symptom of soldier during World War First and Second, and was therefore also termed was combat of stress. Approximately 20% of US troops deployed somewhere in the world were with some having symptom of the chronic stress related disorder. What are stress related disorder? There are two type of classification system. One is RCD 10, and DSM-5. And DSM-5 reveals that first disorder described by in this type of disorder, acute stress relation lasts up to 30 days, and PTSD more if occurs. What there should be a scope between 1 month or more. Adjustment disorder, 6 months and stress if persists beyond 6 months, there is more chance of the person. Other disorder, adjustment disorder, 6 months if stress persists, reaction attachment disorder, and disinhibited social engagement disorder. It can appear that yes, they are more prevalent in the health, more common in women. The lifetime incidence of PTSD is about 9 to 15%, and lifetime prevalence is about 8% in general population. The lifetime PTSD is 10% in the women, 4% in men. Adjustment disorder is diagnosed 12% of general population. 22% suicide attempts uh, AD as the first symptom for the diagnosis. Acute stress disorder is immediate and clear uh, temporal connection between the impact of the exceptional stressor and the onset of the symptom. Usually within a few minutes or few minutes. It resolves rapidly. Very important that it comes rapidly, goes rapidly. Stress once the stressful situation removed. If the stress continue, cannot be reduced. The symptom diminishes after 24 to 40 hours. And I think then next is beside an experience of the traumatic event, diagnosis diagnostic criteria for acute reaction includes the positive experience of transient depression, anxiety, days like anger, disappearance, overactivity as social withdrawal, symptom with no one symptom being dominant. Now, diagnose statistical manual classification, that is called DSM-5 classification, which have certain prefix criteria. First is A, is the exposure to the actual or threatened death, serious injury or sexual violence in one or the following, directly experiencing the trauma, witnessing, learning about the event occurs to a close family members or some other close person. This experience reported or extreme reported prognosis is poor. Now, avoidance symptom. Efforts to avoid distressing moment, memory, thoughts, or feeling about the closely associated with the autonomic event. Efforts to avoid external places, conversation, activity, objective. Reminders, uh, conversation activities, object, situation are that arouse distressing memory thoughts, feeling about the close associated with the traumatic event. Arousal symptom include sleep disturbance, irritable bowel syndrome. Third is hypergenic, hypervigilance, problem with the concentration exaggerated, such type of feeling there may be. Now, one of disorder related with stress is stress disorder. Sometimes people keep on living together, but they don't think they are happy and they feel in the sometimes stress. The arising in the period of adaptation is significant life changes the consequences of the stress life events. Symptom of adjustment disorder is similar to the affective disorder, depression, anxiety. But a diagnosis of very difficult diagnosis adjustment disorder can be given if any identifiable psychosocial by experience and the criteria for diagnosis of a specific affective disorder are not met. The onset usually 1 month of the occurrence of the stressful event. So nowadays, there is a lot of role of mental health authorities there, and they should make your psychiatrist be aware about this disorders. Now, stress disorder and substance use, a close correlation. Lifetime prevalence of substance abuse is ranges from 21 to 41. Rate of PhD among the user is 8 to 33%. Two scenario appears, substance use proceeding HOI is higher risk of physical, traumatic, and risk of physical and psychological trauma. PTSD stress proceeds substance use. Substance use is a form of the medication. CNS depression actually improves PTSD symptom without aggressive symptom, which he re-experiences symptom patient will respond. Development and course. Impaired functioning, social, interpersonal, occupational domain has been shown across survivor. Accidents result in rape, develop acute distress. Interface with the sleep, energy level, and capacity to attend the task is one of second important factor. Third factor is avoidance can result in generalized withdrawal from anxiety situation and non-attachable of the of the medical appointment. Avoidance can result from generalized withdrawal from the any situation on attendance or medical appointment and absentees from the work. Although acute is a disorder for PTSD, that acute is with immediate symptom of age. For PTSD, the time should be at least 1 month because it takes time to develop the depressive symptoms. Approximately half of the individual who approximately half of the individual who eventually develop initially present with the acute distress disorder. Pharma experience can vary across development, like adults, young children, and young females. They have to join. The children more likely to express experience symptom through play. People very. Now, young children also do not necessarily even face tearful teaching to the time of the exposure even during the re-experiences. Comorbidity, high rates of certain disorder. Two-thirds have at least two the symptom. Common are depressive symptoms, substance abuse, anxiety, bipolar disorder. Certain hard facts I like to keep. Certain practical aspect also. Usually in young age uh, or in the older age may happen. It leads to the younger age. The education, female gender, they're more susceptible for the stress. Then the sort of menstrual-related disorder may be there. Result to trauma. Low IQ. This is one of the important area. I think so many people are retarded, but they did not uh, diagnose because people are not aware of. Sometimes we have to, every psychiatrist had to think about what are these stress-related disorder or signs, symptom, acute stress-related disorder, long-term stress disorder symptom or career. The symptom of post uh, it leads to hyperarousal, lower education, conduct disorder, severity of trauma, and psychiatric illness, peri-traumatic dissociation. Now prognosis. It has good prognosis. Rapid onset of symptom if they are short duration of the symptom, good pro-morbid personality after assessment one finds strong social support person has. Then absence of other disorders, medical, social disorders too should be discussed the patient. that a patient was brought specifically in my clinic, and certain investigations were done. Initially, so many doctors they have seen they were not really come to conclusion that they are having. He's having some psychiatric disorder. He was having multiple pains all over the body. That psychogenic pain disorders he was having. And treated as improved. Now, how to differentiate various type of disorder? It could be differentiated from adjustment disorder. Stressor can be of any severity and require requirement of criteria A of acute disorder. Panic disorder, associated disorder, in the absence of characteristic acute stress disorder symptom may be diagnosed as of a derealization, depression, and, and systematization. PTSD, again, the term used, defined if duration is more than 1 month or 1 month. OCD, recurrent intrusive thoughts. In addition, the intrusive thoughts are not related to an experience, traumatic event, compulsive or usually present. Whereas psychotic disorder are also nowadays considered may have be one of the precipitative factor that it must be distinguished from illusion, hallucination, and other perceptual disabilities. Now, coming to the management, aims to relieve the stress associated with recurrent involuntary reminder or trauma, minimize the accompanying behavior, to enhance coping skill, help patient give perspective on the illness, establish social support network. Acute stress reaction may resolve itself within a few days, major symptoms, and suppose that early pharmacotherapy presents, prevents the development of PTSD. Cognitive behavior therapy, which includes exposure to cognitive stress, was found to be effective in treatment of acute stress disorder or chronic stress disorder. Now, cognitive behavior therapy, William James, famous one of the psychologists, suggested that the greatest weapon against stress is one's ability to choose one thought, never. CBT program also essential for teaching. In first aim is more aware to make us more aware about their cognitive appraisal to the stressful event. Second aim, how their appraisals of stressful event can be manifest. And third, teach individual how to develop and maintain use of the variety of effective strategies. Now coming to the stress management. Treatment includes self-observation, cognitive restructuring, relaxation treatment, and time management and problem management. The next type of treatment is self-observation. Daily diary should be maintained, stress related. Then what are the various other type of extracurricular I have written and that could be one included. Self-observation, then comes cognitive reasoning. Focus is to research the dysfunction of maladaptive thinking. Cognitive model, the motion that underlying cognition are major determinants of emotional reshaping. Then last field is uh, Isolated negative thoughts. Stressor leads to certain negative thoughts. Painful medical procedure may create fearfulness. An argument with a friend may lead to discouragement. Co-worker injured with the move, it gives uh, feeling of the discouragement. Co-worker injured by the job, he felt wanted to avoid the danger. Then late life decline, the record from sleep. Hopelessness, I am always missing things up. Messing things up. Spouse citizen criticizes you. Few question of challenging negative autonomous thoughts are: is there an alternative explanation? What is the evidence of thought is true? What will be the effect of continuing thinking? What is the best outcome, worst outcome, most realistic outcome? What is the likelihood of will happen? Negative thoughts and this. If the negative thoughts there is, this should be realized. I have no control over this thought. It should be question mark, make aware, and encourage for the psychotherapy. It is true that I can't change that happen, but I can control how I respond. I You can see, you might have seen a number of cases. Now relax at this treatment. Learn to relax the overall muscle tension, reduce that overall effect of autonomic. And the most important, how to generalize the skill relaxation from home session to the stressful demanding differential diagnosis must be do other disorders should be mini practice. If person is very busy, then he can have brief relaxation for time and first step design enhance awareness, current pattern of time use to set priorities between urgency and importance. Solving. Problematic behavior, thought, feeling, and physiological response if they are, then they can be identified. And my journal generates wide range of alternative problem solution. Individual offer as many solutions as they can, even if the solution do not immediately seem reasonable. No criteria as usual. There should be an attempt to mix and match solution of creative way. Problem solving involves evaluation, alternative and selecting the best solution, implementing the solution. This was about the stress and stress related various disorder, relationship of stress with the anxiety, depression and other type of the uh, psychiatry. So thank you very much. चलो सोते जगते कर डाला कल रात में मैं जानते हो कितने बजे सोया हूँ काफी मैंने कई